Okay, the next presenter is Dr. Sumit Grover, and he will present awareness and knowledge of retinoblastoma among the nurses and allied health care workers.
Thank you, respected judges and the audience. My topic is like away from the OT. Let's go to the public health aspect of the ocular oncology. It's a bit different topic from the which we have seen right now in the session. So we all know that retinoblastoma is the most frequent primary intraocular tumor in the childhood, but the focus of our study, the presentation is the factors that contribute to the poor outcomes, including delay includes delay in the presentation, lack of awareness, poor compliance, and absence of adequate healthcare facilities. And these things have been already been published, and the implication is that in the developed countries where all these parameters are well taken care of, there is trend towards the globe and vision salvage, while in our developing country like India, the mortality rate and the later group E presentations are still a matter of concern. So purpose of our study was to assess the level of awareness and knowledge regarding RB among nurses and allied healthcare workforce in a tertiary care cancer hospital. So it was a cross-sectional hospital-based study which was conducted at National Cancer Institute, part of AIMS New Delhi, and databases of all the nurses and allied healthcare workers, including multitask staff, patient care coordinators, and patient care managers, were obtained, and a questionnaire tool was constructed based on the review of literature to explore the study's aims and objective. The data was retrieved in encrypted form and all responses were kept anonymous. We analyzed the data on Strata software. To coming to the results, there were 411 participants who were involved in the study, out of which 196 were nurses working in the National Cancer Institute, and 215 were the allied healthcare workers. The response rates were 62% amongst the nurses participants and 80% in the allied healthcare workers. As far as the age and gender is concerned, majority of the participants were very much young, like 25 to 35 years, and almost equal female. The males were 239 and females were 172. As far as the educational qualification is concerned, all the nursing staff were categorized into a professional, like they have done their already, they were graduate in their nursing, and amongst the allied healthcare workers, almost all they have been graduated. Since the NCI is in the Jhajjar district, which covers the part of the rural Haryana, so majority of these our participants were from the rural background, according to their residents. So out of the study participant, when we asked about whether they know about RB, like were they aware about RB, so we found that only 28% of the we found that 28% of the nurses and 83% of the allied healthcare workers lacked awareness about the RB. So only 141 nurses said yes, and 37 allied healthcare workers said yes about that they know about RB. And when we ask about the source of information, those who have heard about the RB, they acquired this knowledge as a part of their study or work in the hospital, and only 2% of these respondents reported that mass or social media as a source of their information. When we asked to those who know, who mentioned yes about they know about RB, about the knowledge of sign and symptom, only like 117 nurses out of 141 and 4 out of 37 allied healthcare workers, they knew about the sign and symptom. And when asked about the leukocoria, which is the most common thing, which is the most common sign of RB presentation, around 140 out of 141 nurses, 105 they knew about leukocoria, and only 4 responded out of allied healthcare workers said yes. And knowledge about the treatment of RB, 114 nurses out of 141 they knew about the treatment. Only 1 out of 37 respondent said that I know about the treatment. So when we correlated the awareness and knowledge in participant who have the exposure in the field of eye care, we found that those who worked in an eye care setup previously were more likely to be familiar with RB presentation with the p-value significant. So the study concluded these provided the objective assessment of the level of knowledge and awareness, and we found that fortunately the nurses had sufficient awareness, but it was limited amongst the allied healthcare workers, underscoring the need of continuing medical education and training. And the finding from this study reveals the pressing need to increase knowledge among healthcare providers, because these are the first point of care among the hospital staff and the patient. And it also highlights the lack of insufficient IEC strategies, particularly the role of mass media for creating RB, and a nationwide awareness campaign to educate public and healthcare professionals about early signs of RB and its implication is required. These are my references. Thank you so much.
Thank you, Dr. Grover. Nice and very highly needed study, and I can say this is preliminary study that a multicentric project on retinoblastoma sanctioned by ICMR. You are the one of the investigator,
Yes,
and second is myself.
Yes, sir. Thank you.
So here one question is, were they sensitized before, whatever your healthcare workers?
No, sir, they were not sensitized before, but after this study, we have made a kind of a IEC material for these care providers and the standees and through the electronic media in the NCI, the leukocoria and other things have been displayed now.
Yeah, because initially when they are having an induction.
No, sir. This was like deliberately done. We didn't inducted them, and
Okay.
now we have displayed everywhere about the leukocoria. And
Right. So the main focus of ours is whoever is joining the institute or
Should-
tertiary accreditation center, they should be
yes.
given an induction course.
No,
And
sir.
there you should have all these diseases which are important.
It was a naive population, sir.
Okay.
No wise
Right,
population.
right.
Yes.
Thank